this gentleman did everything right. He was exercising, he was eating well, and yet he still suffered a major heart attack. And now doctors are saying that there is a hidden genetic risk out there that could be affecting 1 in 5 people. Let's talk more about that with heart attack survivor Chuck Lane and cardiologist Dr. Ijeoma Isiadinso from Emory Healthcare. We appreciate you both taking some time this morning.
Thank you.
Thanks for having us.
Chuck, I want to start with you. You say you were doing all the right things. What went through your mind when doctors said you had a heart attack?
Well, I didn't really have much time to react. I had actually just left the gym and I had a major heart attack. Excuse me, had a major heart attack in which one of the arteries in my heart was completely 100% blocked. It's commonly called the widowmaker. And so it was kind of one of those things that blindsided me. I'd always worked out my entire life. I ate right, I didn't smoke, and my job was physical. So I had no answers as to why I might have had this heart attack, but luckily, a couple of months after my heart attack, my primary care physician ordered the lipoprotein A test to be included with my normal blood work, and it came back elevated. So at that point, I had something to go on why I had this heart attack in the first place.
And so you were able to learn that it was a genetic factor. Had you ever heard of that before, and what came next?
No, and I'd worked in healthcare, so I was familiar with different things, but I'd never heard of lipoprotein A. Next came the research, starting to try and look and see what I could find out about it, and it was not very good until I came across the Family Heart Foundation's website. I reached out to one of their care navigators who kind of guided me and gave me information on what I could do going forward. And so that motivated me to become an ambassador and help educate others to hopefully save lives.
Doctor, for people hearing about lipoprotein A, am I getting that right for the first time? I know I am. Why is it so dangerous, and how should they be thinking about it?
Well, firstly, it's important to know that it's a genetic type of cholesterol. That means it's passed down in families. And as Chuck said, it's not part of the normal cholesterol panel. So you have to specifically ask for Lp(a) in order to have that tested. We consider it a risk factor for cardiovascular disease because high Lp(a) levels are associated with increased risk of heart attacks, strokes, and certain types of valve heart disease. So it really is important that you're talking to your clinician about this risk factor to find out if you have it. You need to undergo testing.
And when should you be talking with your doctor? At what age? I mean, Chuck, I saw some photos we were just showing of you and your family. It looks like you got some children. Are they going to be having these conversations with their doctors at some point?
Absolutely. We've actually had my children tested. My son does have the elevated lipoprotein A. He's 19. His isn't as high as mine, which is a good thing, but it's still at the level where he's going to have to be aware of this going forward. So we've talked about the things he could do to help reduce his risk. And hopefully at some point in the near future, there's going to be some treatment drugs available that can help control it.
Yeah, doctor, same question to you. Who should be getting screened right now, and how should they be going about doing that?
Well, every adult should be screened. So anyone over the age of 18, hence why Chuck's son got tested, should undergo testing. And it's a simple blood test. So you can either ask your clinician to do the test for you or order the test for you, or you can go to the Family Heart Foundation website and they can mail you a free testing kit. It's important to undergo testing because it's very common. 1 in 5 individuals, or 20% of the population, has high lipoprotein A, but less than 1% of individuals is aware of that.
Okay, an important conversation, especially for people who think they're doing everything right. Chuck, great to see you you're doing so well, and we thank you both for your time today.
Thank you so much.
Thank you so much.